glass wall makes the difference in what a client feels.
I think so too.
I do think that is a complete game changer.
I'm shocked that we're a month in and there's really never been a situation where I thought we'd need to hit the switch.
Yep.
I know we'll get there. We'll probably end up being once a year. I paid $5,000 for the switch. And we'll use it once a year because a dog has explosive diarrhea all over Nicole. She just lays down on the floor, covered in poop. We're like, we better turn off. We're a month in. We did a month, you guys.
Yes,
believe it?
How are you feeling?
How do I feel? I feel great. I believe that we're fulfilling our mission, that we adhere to this mission of reimagining veterinary medicine, and I believe we truly are. The feedback we're getting, the number of customers that have said this is the best vet appointment that we've ever had, that's not insignificant. We didn't just open a bougie vet clinic and did everything else normally. I think we are doing things differently. But yeah, in the chaos, it might seem the same, right? But caring about, what the guest feels when they're on the other side of that glass is the differentiator.
I feel like I have not changed the way that I practice at all. Like honestly, like I do not feel, even though this, like it's a different environment, but I don't feel like I'm any different to the clients, and like I feel very much everything's the same. If that makes sense. So that I just feel like I fit.
And that's why you're here.
So today's Friday. It's coming to the end of a really long but good week. We've been really busy this week. It's been an absolute delight to see our team really flow well together.
So we've got Teddy in for a routine wellness exam and also a booster for distemper and parvo. And then Teddy's also old enough to get rabies now. So we're gonna do a rabies booster. So let's give Teddy a checkout. You were in love.
Hoping to get a second opinion on his tooth today.
Absolutely. Let me see these teeth.
Whoa.
Oh, I know we just have so much biting to do. We have so much biting.
Good boy.
No,
Good boy.
there's no cause for concern until we lose all our baby teeth. We have big teeth coming in. And that what we hope is that jaw's going to expand out.
Totally.
I'm going to take a picture today,
Okay.
just so we can follow the progress, and we'll do the same thing when we come in. I assume for a neuter?
Yes,
Yeah.
yes.
So we'll take a picture then, and then we'll just keep following that progress.
Perfect.
I think ball therapy is a good idea, just
Yeah.
that palate expander. But I wouldn't be any worried.
Good boy.
Okay, that's perfect.
Okay.
I got it. Hey, let's take a look at the rest of you. There's a little bit of goopiness. If you don't mind, I would love to just get the techs to just do a quick cleaning.
Sure.
Is Dr. Cody desecrating your testicles right now?
All in the name of good health.
Take your temperature. Do you want it in the butt or the ear? This is just the ear ones. Okay, have you ever seen this before? Do you know what this is? You know what this is?
I don't know, but I kind of want it.
Yeah. I'll just get you to just hold shoulders while we're having a little snack. But if you put one of those down with my kids in chocolate pudding, you would do the same thing, and they wouldn't bother so much with their vaccines. So we can do a quick ear clean. We have a treatment window. You guys can come watch, so you can see everything. We've got no secrets. So yeah, you can see in the treatment window. So we'll just be right here. Okay, ear time.
He's really quiet, eh?
Oh, he's super quiet. She said he has never barked. So we just had a little bit of goopiness in the ears. I don't think there's any cause for concern in terms of yeast or bacterial infection. So I'm just gonna take a look in the ear canal just to see what everything looks like. Okay, let's show mom this. Sorry, Eddie. Oh, no worries. I don't think there's an infection. Sometimes we'll have yeast, sometimes we'll have bacteria. It's just a lot of goop.
Okay.
Routine grooming with the ear plucking can help alleviate that, but no cause for concern. Just 30 years. He is a perfectly healthy little pup.
Awesome.
You are a sweet little kitty. You're a sweet little kitty. So just the 2 cats at home?
Yes.
No pups?
No pups.
What about awful kids?
2 kids.
Oh, 2 kids. I'm sorry.
They're teenagers though, they play video games.
Okay, they're pretty good.
Yeah. Both had the same kitten's cold. Hers is cleared up, but his is lingering.
Okay, check your ears, check your nose, check your little belly. You're slippery. You're slippery. Yeah, he's a little raspy.
Yeah.
Because we have a suspicion of a bacterial infection, we just want to make sure that we don't have a fever. If we do, we could add an anti-inflammatory.
No, it's okay, it's okay. It's
just to
okay.
make you feel a little bit better.
I know, it's not fun.
And then also a fever typically indicates a bacterial infection, sometimes viral. Okay, 37.9. You ever just want to go in there? You ever just want to go in there? And I would say if I could redesign this room, I would just put 3 sinks.
That's where she was.
Right? They just love those sinks. Okay, we'll be right back.
Right?
So now we're gonna vaccinate these 2 little kitties. One is for rabies, which is a viral infection. The other one is a viral core vaccine that protects them against a variety of different, typically upper respiratory viruses or pathogens. And then we're going to start Condor on his course of antibiotics for his goopy eyes and sneezing.
You're good, you're good, you're good, you're good.
He has already been on a course of antibiotics, and the discharge came back. So it means we probably had a pretty good handle on what was going on, but just the overall duration of therapy wasn't long enough. Sometimes there's a lot of pathology that we need to get in. If it's like an upper respiratory infection or a sinusitis, infection of the upper airways, sometimes just a longer course of therapy is needed to fully kill all the bacteria that are there. So after this round of antibiotics, if we have the same resolution and then it comes back, we're going to need to do more workup.
Okay.
So that's probably going to mean face x-rays.
Okay, just to see if there's something,
Yes,
drainage.
exactly. We will grab your antibiotics and Nicole will be in to check you guys out. Shot of the puppy. My phone's dead. Oh, hello. Look at this happy dog. Oh, hello, hello. Oh my goodness, hello. Oh, give me all the love.
Today we had the opportunity to meet a nice little puppy named Cody. He's a 9-week-old German boxer that was here for his vaccines and some deworming. We did our full physical exam on him and we vaccinated him with his distemper parvo or his DAPP vaccine. We gave him some Strongia dewormer. How has your new pup been so far?
He's very active,
Yeah.
extraordinary,
It's
cute, so he's getting a lot of love, very
Good.
spoiled.
So I'm gonna just take a good look over him and then we will do his vaccine today. He's just getting the 1 vaccine. So the 1 is his distemper parvo vaccine. So it should be very similar to this. It's the same as this last one. We're just boosting it, okay? Okay.
The breeder, they said like 1 year health guarantee if we get him neutralized. Like,
Yeah.
so how important is that, and how should we do it or not?
Yeah, it is really important because there's more risks about keeping them intact versus not. So an intact male dog, so one that we don't neuter, is more likely to get testicular cancer, prostate cancer, and prostate infections.
Sit. Yeah.
Just checking your brain, you heard
You
me.
handshake.
He looks really good. Like I have no concerns
He's
with him
active.
at all.
Very
Like
active.
he has no abnormalities at all. Everything looks normal. He's gonna grow into a big dog.
Yeah.
Yeah. So we'll do his vaccine, and then this is just some dewormer for him. Okay. So since he's a puppy, we worry about worms.
Yeah.
He should like this though, because it's butterscotch flavored.
Oh, you dropped it.
That's okay. He says I'll probably lick it up. So I will pass this to you, and
Okay,
then you
keep
distract
him
him,
busy.
and I'm just gonna give him a little poke in his
There
bum.
you go.
This is a
There
little
you
one.
go. Here you go. Here you go. You like
Done.
it? Yeah, yummy.
He didn't even notice.
He's busy eating.
I think it's just me that gets
That's
nice
good.
and food motivated, so it's
Yeah.
perfect. We'll re-see this puppy back in another 3 to 4 weeks, where we'll do his deworming again, and we'll also do his rabies, his kennel cough, and then boost his DHPP vaccine. Porter is a 9-year-old intact male dog that presented for some bleeding from his rectum. It's been an ongoing thing that's been going on for the last 2 months-ish. Initially it started, the owner thought it might have been a small hemorrhoid. Dogs don't really get hemorrhoids, so this was kind of a concern of mine actually. One of the issues with intact males, there's a lot of issues with intact males, but I guess specifically dogs, they end up getting tumors around their butt. Sometimes they can be really terrible and malignant and can spread other places, and sometimes the cure to them could be as simple as just neutering them. So we're gonna do a biopsy in the area to figure out whether or not this is something really scary or whether or not this is something that we can get rid of via just neutering alone. And we're gonna take 2 biopsies of the site and send them away to a histopathologist to analyze. So again, just took our little sample. The reason I take 2 most of the time is just because there can be different things in different areas, so we want to make sure that we for sure capture our tissue. So hopefully if it's something that we can fix with neutering, obviously we'll just neuter. If it's something that's more malignant, then we might have to try to remove the mass entirely, which can be really difficult around the anus because it's a sphincter, so it can be hard to get the same sphincter action after. It's not impossible, but it's just a little bit harder, so there's more complications that can come along with it. And we're gonna put him on some antibiotics and some pain meds for about a week, just because this area is so dirty. We don't want these areas to get infected. We had Seamus back this week. Hey, I'm Carly Matika, and we're gonna fix a jaw on a cat. And he had potentially fallen out of a tree and broken his jaw. So we chatted about then at that point that cats have a really weak mandibular symphysis, so it is a common thing that we see from falling out of the tree or getting hit by a vehicle. So what we did to fix it was we wired his jaw closed, so there was a small wire that went over top of his canines and kept things tight together. That we left in for 3 weeks. We retook x-rays today and saw that there was a lot of periosteal proliferation or bony repair between and in the mandibular symphysis. So we were lucky enough to be able to take out the wire. We fixed it.
Yeah, that looks great.
We're a good team. Good job, well mostly it's Seamus. He grew the bone.
Good job, Seamus. You're a good kitty.
Yes, he's a good kitty. What a good cat.
A month in, we're like beyond what I could have ever dreamed for or expected, not just like in terms of customers coming in, but like we're doing it. We're like communicating, we're adhering to it, we're working towards that mission, we're still have great culture. So it's good, it's great, it's amazing.